Hello, I am Dr. Parag Khatavkar. I am a chest physician working in KM Hospital in Pune. Today we are going to discuss some important scientific aspects about a disease called asthma. Asthma is a disease of our respiratory system. Our respiratory system means the system which takes the oxygen from the atmosphere and delivers it to our body. And for this, I am showing this diagram in which, if you see, the respiratory system starts from nose and mouth, and the air from the atmosphere, it goes from the nose and the mouth into the airways, that is the trachea, main airway, which divides into two bronchi, two small airways, which gives the air to the individual lungs. So there are two lungs, right lung and left lung, to which these air tubes, they deliver the oxygen. These air tubes, they divide in a dichomatous fashion, and the smaller airways, they ultimately enter into alveoli or air sacs, from where the oxygen is taken into our body. So for this system to act properly, the airways should be patent. There should not be any obstruction in the airways. And this exactly happens in asthma. The airway gets narrowed. And why this airway gets narrowed? There are some reasons behind it, and the most important reason is a genetic reason, hereditary reason. So somebody in the family, they are having some allergic diseases. Allergic diseases, they may be asthma, or somebody in the family, they may be having allergic rhinitis or runny nose, allergic sinusitis, or some allergic skin rashes. So some form of allergy we may be seeing in the patient's relatives. Now, what exactly this allergy does? So when we breathe, along with oxygen, we breathe a lot of impurities from the air, like dust, pollen grains, fungal spores, or even changes in the air composition during various climates. For example, in rainy season, there is too much of moist air which goes inside, or in dry season, summer season, dry air goes inside. Now, if such a air with impurities, it goes inside the airways, a normal individual will not suffer from anything. But a patient with asthma, the airways will react in a very strong manner, which we call it as an allergy. And it acts, it will respond in three types of narrowing. One, if you see here, this is a normal airway which is seen. This is a patent airway in which the air will go in and out very freely. What happens in asthma? The outer lining of the airways, it contains the smooth muscles, and these muscles, they get narrowed, because if the impure air goes inside, if the dust goes inside, pollen grains go inside, the airways will react in an exaggerated manner. The outer layer, which is made up of smooth muscles will go into contraction or spasm. And if you see in this picture, the smooth muscles, the airways are narrowed, and if you see, the inner lining of the airways has got swollen. It is classically seen in this picture. And if you compare the diameter of both the airways, this is a normal airway diameter, and the airways which are swollen from inside, you will see the airway diameter has got reduced. So the passage of air is less, and the patient will get breathless, or he may get cough. The other reaction of our airways is the inner lining of the airway. It normally produces some amount of mucus, which is important for our body. But in asthmatics, the mucus which is produced is in large amounts, and it is very sticky with less watery content. And this large and sticky mucus will occlude the lumen, which is already narrowed because of the swelling as well as because of the airway contraction. So this is what happens in asthmatics. Now, what can be done for this? Is there any treatment for this disease? Unfortunately, there is no foolproof treatment. The asthma, once you are having one asthma, it will not be cured. That is take home message. But if there is no cure, there are some drugs which are available which make the asthma patient's life very easy, and they may lead a very normal and perfectly normal life, provided they take the medicines sincerely and regularly as their doctors say. There are two types of medications in asthma. One is called as bronchodilator, which dilates the bronchi by relaxing the smooth muscle which have gone into spasm. And these are also called as reliever medications. So if the patient takes the medication, within 4 to 5 minutes, the airways, they dilate, and the patient gets, the breath gets easy, and the patient feels better. The other type of medication is called as preventive medication or controllers. Preventive, it acts on the inner lining of the airways which is swollen, and the swelling, it reduces the swelling, and thereby it increases the passage of the air which can be freely go inside. So these two types of medication, bronchodilators and preventer medication. The bronchodilators are various types of bronchodilators like salbutamol or formoterol or even livolin, or these are the bronchodilators which are available, and preventers are steroids. Now don't get panicky with steroids. These are in very small quantities because we are giving these drugs through inhalation route. So if you take the drugs with inhalers, the amount of drug which is required is very less, so the side effects are negligible. If you compare the side effect with the effects of the medicine, the side effects are much less, but the effect which it does and the patient's benefit the patient which gets is much more. So don't worry about the side effects of the drugs. The inhalers are the drugs which are now the most important modality of treatment for asthma, and it is going to continue for a few years after this. So now what I want to tell the patients is, one thing is to take the inhalers as the patients, the doctors are telling you. Don't stop the medication in between. Even if you are feeling better, continue the medication as your doctor say. Don't stop the medication, don't reduce the dose of the medication. And if you follow these, whatever the doctors advise, then you will lead a perfectly healthy life. Thank you.